My name's Elizabeth Murray. I'm a GP by background, although I retired from clinical practice a couple of years ago. I'm a professor of e-health and primary care at UCL, and my research focuses on how we can use digital technologies, such as smartphones, tablets, computers, to improve patient health and health outcomes and help the health service. Long COVID is a really miserable condition to have, and it's a, as yet, very poorly understood condition. But what we've realised or noticed is that many patients are left with symptoms for months after the initial COVID infection. And that's what we're calling long COVID. Now, it's a horrible condition to have because it's very variable and very unpredictable. So it varies between patients, by which I mean that no two patients have exactly the same experience, but it also varies within each patient. So the way somebody feels this week is not a guide to how they're going to feel next week. And this unpredictability makes it really hard for patients to come to terms with and to plan their lives and to understand what's likely to happen to them in the future. Having said that it's very variable, which it is, there are some core symptoms. And really almost everybody with long COVID experiences profound fatigue, which is very disabling, a cognitive impairment, which most patients call brain fog, which is severe enough to stop people going back to work, breathlessness, which is probably a direct effect of the virus on the lungs, and then anxiety and depression. Our data come from the first wave, and in the first wave, it appeared that about 2/3 of patients who'd been discharged from hospital were still very symptomatic at 3 months after discharge. And data from the King's Zoe study suggests that around 10% of people who were never admitted to hospital have long-term symptoms. Now, I was looking at the government dashboard for our current figures for wave 2, and now at the beginning of March 2021, it seems that something over 4 million, more like 4.2 million people in the UK have had COVID, and it seems that there have been around 440,000 people admitted to hospital. Now, if you apply the proportions from the first wave to those numbers, it would suggest that somewhere in the region of 600,000 to 700,000 people in the UK will develop long COVID or already have long COVID. So it was clearly urgent to find a way of enabling the staff that we do have in post in the NHS and the resources that we do have to enable those staff to manage much larger numbers of patients than they can using traditional face-to-face models. And clearly digital technology has a role to play. And so this is how we came up with the idea of digitally enabled, remote supported rehabilitation for people with long COVID. And the program that we've developed, which is called Living with COVID Recovery, has 3 components to it. The first is a clinical pathway. And by a clinical pathway, I mean a way that patients can get to be seen. So who do they get referred to? They need to be referred by a GP or by their hospital consultant if after discharge from hospital. And they need to go to a long COVID clinic. And there they need to be assessed, partly to make sure that they're safe for rehab, and also that they're suitable for rehab, that their symptoms are indeed due to long COVID and not due to anything else, and that the symptoms that they've got are likely to respond to rehabilitation. Then they need an assessment by a multidisciplinary team where the patient goals for treatment can be ascertained, and the clinician, be that a physiotherapist, an occupational therapist, or a psychologist, can negotiate with the patient and agree a treatment plan for that particular patient. That clinician will then need to review and monitor and support the patient through the treatment until they're well enough to be discharged. And if, unfortunately, they're not getting better, that clinician also needs to be able to escalate care so that patients do get the care that they need according to their symptoms and their problems. So that's a clinical pathway. The other two components are digital. One is the patient-facing app, which actually delivers the treatments that we're talking about. So that's the treatments for breathlessness, treatments for fatigue, anxiety, depression, brain fog. And it also collects data from the patients in the form of questionnaires, or what we call patient-reported outcome measures, which are validated measures which give a reliable sign of how patients are doing and whether their symptoms are getting better or worse. The app also enables patients to message their healthcare professional, their clinician, who can message them back. And this allows for very patient-centered, tailored support from the clinician in a very time-efficient way. The third component is a digital dashboard, which the healthcare professionals use to look after the patient in their clinic. That dashboard displays data that the patients have put into the app, but it displays it in a very effective way for the clinicians to review, so that they can quickly see, if they're looking after, say, 100 patients, which of those 100 patients are getting better, which of them are going on all right, and which are getting worse. And they can therefore prioritize which patients they spend their time on. But they can also review each and every patient very quickly. And one of the things we're very proud of is that in one of the sites that we're live, the physiotherapist who's looking after patients there, she currently has a caseload of around 120 patients. And she reviews each of those patients every week, but she manages that in half a day a week, because it only takes her 2 to 3 minutes per patient to see how they're getting on, read any messages that they've sent her, and reply to them, explaining what they need to do next. And the data show that patients really appreciate the time that she gives them. They feel cared for and they feel listened to and they feel supported. But it is a hugely efficient use of clinician time. We set out to take a very patient-centered focus. And so the team that's working on this has 4 big groups, if you like. And one of the really important groups is patient and public involvement, or PPI. And so we have a big group of PPI, and they're really clear with us about what the patient experience is and what the patient needs are. And that's teamed with a great deal of clinical input from really expert respiratory physicians and physiotherapists and specialists in fatigue and cognitive impairment. So we're getting really expert clinical input. And the 2 other partners are a provider company, understand how to put all this together and make the digital software, and also how to deploy into the NHS, and a team of academics that are doing the research and evaluating it. And all 4 groups, as it were, are equally important to this project. But having the patient voice really at the centre has enabled us really to try and develop a very patient-centred approach to treatment. That's part of it. I think another part is that we're very keen to use what are called validated patient-reported outcome measures. So we know that the data that patients provide through filling in these questionnaires is valid and reliable. And if the patients are reporting a change in symptoms using those measures, we know that the chances are that change is really happening, that is a true change. I think one of the things that's really important about our approach, we're using a user-centered design approach where we listen to what people want and need. We try and meet those needs, but we then ask them, so to what extent is this working for you? And what do we need to change? And it's a very iterative process, working with the clinicians, with real patients and with PPI, really trying to refine the product all the time so that it's getting better, to meeting clinician needs in terms of being able to offer the care that they want to give, and meeting patient needs in terms of actually providing the treatment and the support in a way that makes sense to them and actually does help.